Hello, everyone. Good evening. Today, we're going to be talking about how blueberries affect the cardiovascular system. What is a blueberry? You're going to find out a blueberry is not a synthetic compound. A blueberry is composed of many, many different chemicals. So let's talk about the cardiovascular system. You have the heart, you have the blood vessels, and then you have the blood that flows through those blood vessels that's pumped by the heart. And the blood is also itself a system. It's composed of not just red blood cells, which carry the oxygen, but it also includes the white blood cells, which support your immune system. So it's a complex system of systems. The vessels consist of three subsystems: arteries, veins, and capillaries. The tunica intima is the inner layer, which consists of the endothelial cells, and that provides a frictionless pathway for the movement of blood. So if you want to have good vascular function, those endothelial are extremely important, the endothelial cells. So right now there's over 2,970 research articles done on blueberries and 103 clinical trials over the last 110 years. Now, to study this, we use a very powerful technology that I built out of my research work at MIT called CytoSolve. CytoSolve provides us the tools to do that because a blueberry is a multi-combination therapeutic. It's got many, many different compounds. We can actually validate food and combinations of many, many compounds. So you can see people have done a lot of clinical trials. Clinical trial is not a systems approach. It's good. So they put something into someone's body and they look at what the output is. The work of CytoSolve really helps figure out why this stuff works. And CytoSolve literally takes all the research, all that work that's been done. We extract out the molecular mechanisms. We understand the pathways relative to cardiovascular health. And then we organize that data, which is what I'm presenting to you today. What I want to share with you is when you look at all of these compounds with CytoSolve, we're able to understand this. I wanted to let you know that we use the technology here. We've helped many, many companies over the last 16 years, a lot of smart, innovative companies, but we decided with all the mathematical models we've created, why don't we try to use this to compute the best product we could think of from the science out there for reducing pain and inflammation, pain and discomfort. And that resulted in us creating MV25 using CytoSolve. We're going to have more products that are going to be coming, but let me just show you what MV25 is about for those of you who haven't heard about it. But this is using CytoSolve in a beneficial way, not to just do research, but find combination therapies.
Hi, I'm Barbara Ann. My hands would cramp up so that I couldn't hold cards or knit or crochet, and they would go like that. And I'd have to use this when I played cards with my grandkids. Then I started taking that MV25. After a bit, I was able to hold cards in my hand. Very, very little cramping, hardly at all anymore. MV25.
Hi, my name is Sandy. I'm a Taekwondo instructor. I tore my ACL during Taekwondo. I had a lot of pain and limited mobility. I've been taking the MV25 for about 6 months now. After the first week, I noticed a big difference. After the second week, almost literally no pain.
My name is Jeremy, and I suffer from a lower back problem. Hurt my back at work years ago, and I can go to the chiropractor, do all kinds of different things, and nothing seems to help. And I decided to try MV25. I didn't notice a difference immediately, but within a few days, the pain went away, and it stayed away. I've continued to take it, and even when I do things that I shouldn't do, it seems to go away a lot quicker than it ever did before.
It's clean food certified. It's made in the US. If you go to vashiva.com, right on the shop, you'll click there, or you can go right to mv25.life, either way. And then from there, you can click on the bottle and you can order. If you buy 6 bottles, you get 6 bottles for free. Please take advantage of it because first of all, it's going to help you. It's going to help our movement, and it really supports the fact that we want to take science-based approaches to natural products. Let's look at the science of a blueberry. It's got macronutrients, fiber, protein, fat. We have a lot of micronutrients, vitamins, mineral, phenolic compounds, and anthocyanins. These are the ones that really have the active effects on the cardiovascular system. Let's look at the biological effects of blueberries. Well, first of all, blueberries are anti-inflammatory, antioxidant, anti-diabetic, anti-cancer, hepatoprotective. They protect your liver, anti-obesity. A lot of very powerful effects. So what are the health benefits? Well, cardiovascular disease, alleviate hypertension, liver health, vision health. A lot of research done on blueberries and vision health, diabetes, obesity, cognitive function, and cancer. Today, we're focused on the cardiovascular aspect. So when we look at the CytoSolve's approach, you're going to very quickly understand understand the role of nitric oxide on endothelial function. Nitric oxide is a vasodilator, which means it relaxes your blood vessels. It's very important maintaining blood pressure. It's anti-atherogenic, which means against arteriosclerosis. It is generated, so nitric oxide gets generated when this chemical eNOS, which means endothelial nitric oxide synthase, when this helps convert, that's what catalysis means, or create or support the creation of L-arginine. Okay, so eNOS catalysis of L-arginine creates nitric oxide. You're going to see that how that happens. What you see is the surface of the endothelial has a little Christmas tree-like structure right here. And what this does is this Christmas tree structure is known as a glycocalyx. When blood flows, that's what these blue lines represent. The blood flows and it starts shaking this Christmas tree, the glycocalyx. That movement results in the release of nitric oxide that occurs through a series of chemical reactions you're seeing here. This is called a molecular pathway. This is a molecular system, okay? So blood flows over the endothelial, it moves the glycocalyx, and the mechanical movement of the glycocalyx initiates the conversion of L-arginine to nitric oxide in the presence of eNOS. How do blueberries actually affect the cardiovascular system? So the health aspect is blueberries are shown in considerable amount of literature to be anti-hypertensive, anti-diabetic, anti-hyperglycemic, and anti-atherosclerotic effect against atherosclerosis. Again, these are those important chemicals we talked about. And these things work together to support various aspects of endothelial function. So first of all, the endothelial cells produce nitric oxide from enzyme eNOS, okay? So this is the endothelial cells. So eNOS helps produce nitric oxide. Okay, so it goes through uncoupled eNOS and you get nitric oxide. Now, nitric oxide right here activates SGC. SGC is important because it converts GTP over here to cGMP so this is your smooth muscle cell, which lead to their relaxation. When you have relaxation, this promotes vasorelaxation, which promotes anti-hypertension. When you have oxidative stress, this is not a good thing, which is stress in your system, which creates reactive oxygen species. Look what that does. That stops eNOS right here from producing uncoupled eNOS to create nitric oxide. Okay, but look at this. When you take anthocyanins, which come from blueberries, it neutralizes ROS. So when you knock out ROS, this chemical reaction can produce properly. That's what's good. The next chemical we want to look at is anthocyanins and quercetin. So when you have both of these, they do something important. They're anti-diabetic. Now, how do they do that? Well, first of all, endothelial dysfunction is caused from oxidative stress. If you have superoxide and you have hydrogen peroxide, these are not good molecules. They lead to endothelial dysfunctions, which leads to diabetes. So what stops the formation of these two, superoxide and hydrogen peroxide? Well, two very important chemicals. Superoxide dismutase blocks superoxide, that's good. Catalase blocks hydrogen peroxide, that's good. And so how do you get these? Well, if you go upstream, there's a chemical called NRF2, and NRF2 promotes superoxide and promotes catalase. And NRF2 produces these two antioxidant enzymes. And guess what? Quercetin from blueberries and anthocyanins from blueberries actually support the upregulation of NRF2 in the endothelial cells. Very, very valuable. So anthocyanins and quercetin lead to the upregulation of NRF2, which creates superoxide dismutase and catalase, which blocks these bad chemicals, superoxide and hydrogen peroxide, which lead to endothelial dysfunction. Very, very valuable. Let's now move to another aspect of how blueberries have an anti-diabetic effect. So hyperglycemia, too much sugar there, leads to diabetes. So how do you stop that? Okay, hyperglycemia. Well, let's go upstream. So there's a very important peptide called glucagon-like peptide 1, GLP-1, that induces insulin secretion in the pancreatic beta cells. Well, what supports that? Well, anthocyanins from blueberries support GLP-1, which leads to more insulin secretion, which increases glucose uptake, right? So it reduces glucose in your bloodstream, right? So this leads to lowering blood sugar and mitigation of hyperglycemia. Hyperglycemia leads to diabetes. Anthocyanins from the blueberries control the glucose blood by upregulating GLP-1, which increases insulin secretion. So in some ways, you're almost getting a natural insulin release. So blueberries mitigate diabetes by reducing hyperglycemic condition. There you go. And then the final thing I want to talk about is the anti-atherosclerotic effect. What this means is plaque formation. How does plaque get formed? Well, the LDL gets converted to OXLDL, and this happens when you have superoxide, when you have endothelial dysfunction. When your endothelial is not working well, you produce these reactive oxygen species, oxidative stress to be specific, and that supports the conversion of LDL to OXLDL, which leads to plaque formation. This pathway right here is not something you want. But guess what happens? The anthocyanins and quercetin in blueberries block this pathway. So they block the formation of OXLDL, which leads to arterial plaque formation. Okay? Because OXLDL adheres to the endothelial cell surface and initiates plaque formation that leads to narrowing of the arteries, causing arterial sclerosis. Really powerful, these blueberries. All right? Now, I've shared everything with you from a molecular systems perspective. There's also another way from an engineering systems perspective and from an Eastern medicine perspective. Well, blueberries stabilize the transport in your body, they stabilize conversion, and they increase storage. That's what they do, which means they help build tissue, okay? They help build infrastructure, but they stabilize digestive processes, they stabilize, if you're erratic, they help calm you down also, okay? So that's what you see here. How much should you take? So again, the medical disclaimer is it's not a medical show. This is a systems educational show, but we're just looking at what's out in the literature, and we've organized and aggregated it. Cook et al. Says you can take about 350 milligrams a day of anthocyanins, which will help reduce hypertension. Now, the blueberry extract also supports memory performance. That's from White et al. 2018, about 100 milligrams per day. Freeze-dried whole blush blueberries, freeze-dried powder, really helps obesity control, and that's 2% weight per day. Okay, and that's Seymour et al. 2011. These are some work from the research. The next piece is I want to talk a little bit about organic blueberries. Okay, remember, the organic blueberries are preferred over conventionally grown. The conventionally grown contain a high level of pesticides. The thin skin allows the chemicals to enter the fruit's flesh. So organic farming produces healthier fruits. If you can't get organic, understand the source. Maybe you know of some people. Sometimes the organic certification is hard to get. If it's wild blueberries, very good. Just make sure there's no pesticide runoffs. But the organic blueberries also have more phenols, more anthocyanins, higher antioxidant activity than conventionally grown. And we have created a whole certification called Certified Clean and Certified Raw. And you'll see these certifications where we said products should be safely produced, minimally processed, and bioavailability. And this was something we actually created a certification you'll see on products out there. So in summary, blueberries have several health benefits, including cardiovascular health, cognitive and vision health, good for the brain. The anthocyanins from blueberries upregulate and release the vasodilator nitric oxide NO, which lowers hypertension. So now you know why. Blueberries lower blood glucose levels by upregulating more insulin, right? Through that GLP-1. Blueberries also promote upregulation of antioxidant enzymes that mitigate diabetes via downregulation of those oxidative stress molecules. And then finally, blueberry compounds prevent arterial sclerosis by downregulating oxidative stress that causes plaque formation and hardening of the arteries. So there you go. So thank you, everyone. Have a good evening.